Hey y'all, my name is Nico. I'm a third year med student and I'm interested in neurosurgery.
Hi, I'm Katriana. I'm a second year medical student and I'm interested in surgery, still figuring out what subspecialty.
I'm Spencer, the non-medical student of the group, but I do have a broad STEM background and plenty of exposure to a hospital setting from the other side of the OR.
The reason that I want to do simply surgery is that while I was studying for my clerkships, I realized that there wasn't a single resource that integrated all of the different things med students need to know for preparing for the OR. So anatomy was in one book, and the conditions and the pathophysiology were another book, and then the operative steps were deep in the recesses of the internet. And so I wanted to combine all of that to help save med students time instead of spending 2 or 3 hours prepping for a case, maybe 30 minutes to an hour, and give them a little bit of much needed and much deserved work-life balance.
The reason I want to do simply surgery is that I'm super excited to start clinical rotations, but also I've heard it can be a little overwhelming because of all the information you have to know. And it seems like you kind of have to figure out a lot of it just as you're doing it or, study it on the side. But our hope with Simply Surgery is that we're able to be a resource for students to be able to feel a little bit more confident and less overwhelmed going into clinical rotations.
And for me, simply surgery is all about bridging the gap between some arcane and technical language that might not be approachable for the average person or even the average person going into medical school. And so bridging that gap is really important in sort of establishing what's going on behind the curtain and how that can be digested as somebody who's not as into specific medical terminology and medical education.
The first part of our channel is going to be step-by-step walkthroughs for surgeries to help you prep for them if you're a med student, and if you're not a med student, just learning a little bit more about what goes on in the OR for whatever case, if you or a family member is about to go through that. And so the way those are going to work is we're going to talk about everything from the indications and contraindications for those surgeries, so the reasons why or why we wouldn't do those surgeries, and then the relevant anatomy, some important physiology stuff, things to think about beforehand and afterwards. We'll also go through all of the operative steps at kind of a high level, including operative footage, so that especially you med students getting ready to scrub in, you actually know what the anatomy looks like, not just out of a textbook. And then we'll finish by covering a lot of the pimp questions that you might be asked while you're in the OR. So pathophysiology, treatment, diagnostics, all that kind of stuff that will all be covered in our videos.
We'll also be sharing videos on how to do everyday tasks like scrubbing into surgery or suturing. We're also going to have a section that is going to be interviews with physicians. So, the goal of this section is to really understand what it's like to be a surgeon in different subspecialties. So, we'll learn a little bit about their everyday lives, about why they chose that specialty, things they wish they knew going in, and kind of tips and tricks on how to do well in that subspecialty when you're rotating with them.
And I'm really excited, especially in that first part of our content, the surgical OR videos, to be asking the why and really digging further into what's going on, even if that might not be as necessary for the medical procedure itself, just providing that background. And then our third part of our content is going to be patient experiences, actually interviewing people who've gone through a given procedure that we're covering and being able to sit down for a Q&A and asking them the questions about qualitatively, what are things like going into it? What are things like coming out of it? And then just really capturing that element as well.
We're super excited to be sharing our content with you guys. Make sure to subscribe, that way you get updates whenever we post a new video. Also, if you have any comments or suggestions for future videos, please feel free to email us. Our email is simplysurgery1@gmail.com. We also have an Instagram, so you can message us there, which is Simply Surgery. But we'd love to hear from you guys, and we are excited for the future of Simply Surgery.